Skin cancer is an abnormal growth of skin cells, which is usually caused by the sun's harmful rays. It occurs as a result of too much exposure of the skin to sun or indoor tanning. As a result, DNA in the skin cells becomes damaged, making the cells grow or divide in an uncontrollable way. The types of skin cancer a person gets is determined by where the cancer begins. If the cancer begins in basal skin cells, it is called basal skin cancer. When the cells that give our skin its color becomes cancerous, it is regarded as melanoma. There are several types of skin cancer, but in this video, we will be discussing the three most common types of skin cancer. Basal cell carcinoma, squamous cells carcinoma and melanoma. 1. Basal cells carcinoma. This is the most common types of skin cancer, which develops from the basal cells, and are found in the deepest part of the outer layer of the skin. It is mostly found in people who have fair skin, although it can develop on every skin. Basal cells carcinoma usually develops after so many years of frequent sun exposure or indoor tanning, and it is common on part of the skin that is mostly exposed to sunlight, such as the face, head and neck. The signs of basal cells carcinoma include a white lump or sores with a translucent appearance. The lump may be shinier than the skin around it, with tiny visible blood vessels. An open sores which does not heal or may heal but keep returning back. The sore may be itchy or painful. The sore may form an ulcer, which can ooze clear fluid or bleed when touched. Early diagnosis and treatment of basal cells carcinoma is important, because they have the ability of penetrating nerves and bones, causing damage and disfigurement if they are allowed to grow. 2. Squamous cells carcinoma. Squamous cells carcinoma is the second most common types of skin cancer, which develops in the squamous cells that make up the middle and outer layer of the skin. It mostly develops in people with light skin, and can develop also in people with darker skin. Squamous cells carcinoma tends to develop also in areas of the skin that is frequently exposed to sun, such as the head, neck, face, arms, chest, back, and the rim of the ear. It does not grow deep into other part of body, it can only grow into cells of the skin. The signs and symptoms of squamous cells carcinoma include a rough, reddish scaly area, an open sore, a firm dome-shaped growth, wart-like growth, tiny, rhinoceros-shaped horn, growing from the skin, and the development of sores in an old scar. Early diagnosis and treatment of squamous cells carcinoma is important, in order to prevent it from damaging the cells within the skin. 3. Melanoma. Melanoma is the most serious and deadliest form of skin cancer that can occur in anywhere in the body, and can easily spread to other organs and tissues of the body. It occurs when the pigment-producing cells that gives color to the skin becomes cancerous. Melanoma can develop in both open or hidden part of the body. People with fair skin are at higher risk of developing melanoma than dark-skinned people. That is because people with more pigmentation have more natural protection from the sun. The first sign of melanoma is often a change in color, shape, size, or feel of an existing mole. A mole is a non-cancerous growth on the skin that is formed by the cluster of pigment-producing skin cells. It is commonly called birthmarks. The best way to identify a melanoma skin cancer is the mastery of the ABCDE signs of cancerous mole. A stands for asymmetry. Moles should have a uniform round or oval shape, but when one half of the mole does not match the other, it indicates a sign of cancer. B stands for border. The edge of a normal mole should be smooth, but when it is ragged, notched, uneven or blurred, it indicates that the mole is becoming cancerous. C stands for color. A mole should have a uniform color of either tan, brown or black, but when it has a mixture or a shades of different colors, it indicates cancer. D stand for diameter. The diameter of a healthy mole should not be more than 6 mm or 1/4 inch. E stands for evolving. It is the most serious of all. It involves a general change in the appearance of a mole. A mole might look different from the rest. Other forms of skin cancer include cutaneous T-cell lymphoma, dermatofibrosarcoma protuberans, Merkel cell carcinoma and sebaceous carcinoma. The general and most common causes of skin cancer is excessive exposure of the skin to the harmful ultraviolet radiation from the sun. You can prevent yourself from developing skin cancer by 1. Staying in the shade, especially from 10 a.m. to 4 p.m. 2. Wearing clothing that covers your arms and legs. 3. Wearing a hat with a wide brim to shade your face, head, ears and neck. 4. Wearing sunglasses that wrap around. 5. Addition of vitamin A, C, E, zinc, selenium and so on diet can help reduce the risk of developing skin cancer. 6. Avoid tanning lamps in bed. 7. Be familiar with your skin, so that you will notice any changes and contact your doctor as soon as possible.